Here is your question. Right, so if you have read and understood, considering it clinical examination station, kindly please begin.
Okay, I will wash my hand. I introduce myself. After this, I will confirm the patient name and age. And after this, I will ask the patient to start from take permission of the patient and explain the test. After this, I will start with optic nerve, with olfactory nerve. I ask the patient, do you have any problem with smelling or change? He said to me, no change. If there are coffee beans, I make he smells the coffee beans. Optic nerve, okay, I will move now to optic nerve. I will check the visual acuity, the field, the confrontation test. The patient with light and the sensor neural light reflex, accommodation reflex. I will make, if there's middle chart or color chart, I will tell the examiner I should examine the color chart with the chart. Okay, and now I will move for the third and fourth and sixth nerve with each test. I ask the patient before, do you have any pain or double vision? And I will make each test for and notice the patient movement, eye movement. I will notice maybe he has abducent nerve injury and he can't give lateral goes. After this, I will go for the fourth and fifth and the sixth and the trigeminal nerve. Now I will ask the patient to clench the muscle of mastication. I will feel up and down, and after this I will try again against resistance, and he open his mouth and try to open against resistance. This is the motor part and about sensation with cotton wool or with monofilament or pin. I will ask the patient to I give him example for everyone, and he close his eyes and make it bilaterally for 3D vision of trigeminal. He say okay, intact in the feeling. He feel all of them. After this, I move to facial nerve. I ask the patient if he feel any problem in taste sensation. He listen to high voice more than usual, and this is the sensation part. And about the motor part, I will ask the patient to elevate eyebrow, open the eyes against resistance. He blow his cheek and against resistance, and smile and whistle, and tense his cervical muscle. This is the facial nerve. After this, I will move to 8, and I will whisper in the patient ear. After this, I will make Cranial test, and with vibration and viber and Cranial test and whisper test. I ask the patient to walk on the spot, and I protect the patient with closing his eyes. After this, I move to 9 and 10 to ask the patient cough and say and see the uvula movement. I ask the patient for 11 movement against resistant his neck, and 12 and protrude his tongue, and he tried to move his tongue against cheek. And I will, to complete my examination, I ask the patient to make an full neurovascular examination for upper and lower limb, and the mini mental score examination if the time possible. My provisional diagnosis will be
okay, are you done with the examination?
Yes,
okay.
I done with examination.
So what are your provisional and differential diagnosis for this patient? Or what are your, first you can maybe summarize your examination.
Okay, today I examined this gentleman, 43 years old. He has a lateral, he can't look lateral goes. This is indicate abduced nerve injury in this side, and he has low visual acuity on both sides. He decrease in visual acuity. So he has no headache, no increase in intracranial pressure. He has intact trigeminal nerve. He has no problem in other movement of the cranial nerve for the eyes. He can intact facial nerve, intact glossopharyngeal nerve, intact.
So now please tell me your provisional and differential diagnosis.
So my provisional diagnosis, anterior cranial fossa tumor, and my differential diagnosis will be meningioma and cranial body tumor, pharyngioma, and choroid plexus tumor.
Can you tell me
thalamus tumor?
What, yes, with this condition, what investigations would you ask for?
I will ask for a CT with contrast and MRI with contrast to see where exactly is a tumor.
Yes, and
I will ask for X-ray to see if there are any calcification in the skull. And I will make to taking biopsy, sclerotic biopsy, make some blood test.
Okay. What management would you suggest for this patient?
Transsphenoidal or transnasosinus surgical excision, or transsphenoidal, excision of the tumor.
You'll involve MT and?
I will involve multidisciplinary team, neuro and tumor surgery and oncology team.
Yes.
And I will make sure operating theater team too, anesthesiast and neurosurgery.
Yes. And then you'll decide what management you have to give to the patient. Yes. All right. Right. Yes. Okay. Thank you.